Hello, Diaz here, founder and owner of Greenwood Dental. Thank you for joining me again for another episode of your guide to dental health with Diaz. I just want to thank all the patients that have commented on these videos. As you know, dentistry is a very private profession, and I don't get comments obviously on YouTube because of the whole social media thing, but I get tons and tons of questions about the videos through the practice as I see you guys coming through. And it's all great feedback. You guys are really excited about watching me, and the response, it's been great and very, very positive, and keep going, very encouraging, very supportive. So thank you for that. Today we're talking about something called recession. This term, some of you guys would hear us address it during your recare visit. The recare visit, which is the visit that you guys come in every 6 months, 4 months, or 3 months. So what's recession? Why is it constantly the subject of discussion, or a condition that's constantly been pointed out when you guys are in our office? So recession, from the word receding. So receding gums is a condition when the gums are pulling away from the roots. The roots of the teeth are supposed to be submerged, being covered with bone and gums to protect the nerve. The root itself is what houses the nerve. So if you have a lot of pulling of the gums away from the roots, that can cause sensitivity, that can cause damage to the root, that can cause, in many cases, also decay. And it catches that part of the root. Unfortunately, in dentistry, we don't have a very efficient restorative methods to restore the root without, a root canal, without bonding. Sometimes the bonding will last, or without even grafting, which is adding more gum to the area to cover the root. But the bottom line is, at the end of the day, we would like to see this root completely covered by bone and completely covered by gums. What causes recession? A couple of things causes recession. The first thing is brushing too hard with a hard bristle manual toothbrush. Again, watch my video about the tools, the difference between Oral-B and Sonicare and manual toothbrush. I don't care what kind of tool you guys use, as long as you achieve the 3 things that I repeat constantly every day at the office to hygienists and to patient. As long as you kick the plaque off, as long as you keep the plaque off, and as long as you don't traumatize the gums, okay? But sometimes some of you scrub so hard that you scrub away the gums, and the gums start receding away from the root. As you continue brushing, you will actually wear down the roots. We find notches on the roots. And sometimes, many times through the years, I've actually seen that pink line, what we call the nerve. I'm staring at it. Some of you will have sensitivity with minimum recession, less than a millimeter recession. Some of you will have no sensitivity, even with the amount of wear on the roots. So every case is a little bit different, and every case will be treated differently or design the treatment differently. So that's what recession is. In order to prevent recession, you have to make sure that you're using the right tools. You have to make sure that you're using the right methods. You have to make sure that when we point it out to you, let's take it a little bit seriously. Now, if you hear us saying that, oh, the degree of recession is at the point of you would need grafting, you're gonna see the gum specialist, that's a lot of recession. I've seen patients through the years with 8 millimeter recession, like the whole root is exposed, and I'm looking at it, it looks like a mannequin, looks like a, fake, and like, how is that even possible? And the patient has no sensitivity. So the sensitivity varies between patient to patient, the treatment varies between the severity of the condition of the recession, but the recession is a serious condition because we are trying to protect the nerve that is housed by the root, and the root's supposed to be submerged under the gums. So if it's not submerged under the gums, we don't know internally what is the amount of stress that the nerve is going through with that kind of exposure. Okay, so if you guys have any questions, please let me know. I know some of you, like I said, they're watching, but they wait until they come in the office, then ask me a question. I hope this helps and clarify the whole thing about recession. It's not economical recession. I hope not. We can't have that. It's more gum recession. So I'm out of time. Thank you for listening and thank you for watching. I hope this has been an interest to you. And if you would like me to make a video about specific topics, please reach out to us. Even just call me at the office, that's fine. I would do that. So I'm out of time. We love you. Be safe, and DS out.